maintain health. It's actually 1 day or 2 days one. It's actually long-term one, long-term thing. So if let's say every month or maybe every day help me to improve or maintain 20 or 20%. Okay, so in 10 years time, you can see that actually our health has actually you can gain back your health already, you see. So this is actually what I expect also. So of course, people say that, wow, this one can cure, this one can help to improve, then no more doctor already. No, we don't say that, okay? Still, it depends on individual. As what I say, if let's say today, we know that the arm laser is so good, okay, we cannot say that with arm laser, you can actually, you don't need to sleep, and then no need to go for exercise, or you can, 3 meal, you just take Maggie meal, do. Oh, no, sorry. Okay, this is actually what we cannot misuse of the device, okay? So I think the time almost time ready. Let me see. Okay, wow, 61 already, 61%. Okay, for those just enter. Okay, I would like to say hello to everyone. Okay, I'm Jaslyn here from Penang. Okay, just now I just talked chit-chat a little bit about why I'm here today. Okay, so I think let me do some introduction. Okay, I'm Jaslyn from Penang. Okay, so today very glad and also welcome everyone to be here today. Before I start, I would like to wish for those people to celebrate Tapusam, happy Tapusam to everyone, and happy Tapusam to yourself. Okay, so okay, so we are here today. I hope that you all know the purpose we are here today. Okay, you all know or not? Looking forward, right? Okay, so Dr. Ashvin is actually, in fact, a very how to say our company and also a concert. Okay, before we start, let me introduce a little bit about Dr. Ashvin. Okay, let me share a little bit. Okay, can you? Okay. So it's actually Dr. Ashvin. Dr. Ashvin, you can pronounce it from here. Is actually a senior medical doctor, more than 2 years of experience. Okay. Serve both government and also private medical sector in Penang. Besides his modern medical practice, okay, Dr. Ashvin is also very passionate about functional, preventive, and also nutritional medicine. Okay, so natural therapy lah. He also strongly believe in naturopathic, antioxidant, and also photobiomodulation therapy. This is actually what we want to discuss today. Okay, so for those first time joining us, please be with us until end of the session. Okay, so it is noted that Dr. Ashvin is actually a well-known speaker at many community projects, okay, health forums, and also medical conference. So for those first time met Dr. Ashvin, okay, so please want to go toilet now, just go washroom, want to drink water, please bring along your water tumbler, put in front of your table, okay, don't miss every words that doctor said. Okay, so okay, without further ado, I would like to welcome Dr. Ashvin to be here. Okay, welcome, Dr. Ashvin. Okay. Okay, okay, just a second.
Hi, good evening, everybody. Okay, so first of all, and happy holidays to everyone. And I guess this is the new norm of doing presentations now. And thanks to COVID virus. So this is actually interesting compared to doing talks, which is in front of people and in front of a live audience. But still, anyway, I hope everyone has had dinner. And yeah, it's actually quite interesting how this whole COVID virus has affected the whole world globally, and you know, the impact of it. And heartfelt wish to all those people who are afflicted in terms of their career or financially or health-wise or otherwise. So we just want to know that everybody, that we are all here for you. You know, if people need help, turn to one another. This is an important time in the world where we should depend on our family members, on our friends. We should be kind and supportive to one another. So I think that's a very important statement that I'd like to make for everybody out there. So some of you all are already familiar with what photobiomodulation therapy is about, and some of you, this is something that's new, and it's actually been around for about 15 years now, minus. A lot of applications that it can be used for. Today, we'll be focusing more on how it has antiviral benefits for its immune system. It is one of the diseases that it can actually help boost up our immune function and actually help to make us more healthy and also maintain our health during these difficult and trying times. So I'm going to start off to explain about how COVID and photobiomodulation, what their relationship is like. Now, most of us are already familiar about the coronavirus and how it is a RNA virus, and I'm not going to go too much into the synergy and all the other features about. Go more into the treatment of COVID. Firstly, one thing that is quite important is to prevent the virus from entering into the person's cell, right, into the person's body. And once this has happened, we will be talking about how to prevent the virus from replicating and spreading further and multiplying inside the body. And also the importance of having a good immune system. There are actually 2 to 3 types of immune system. The main type is our innate immune system, which is like our skin, our mucous membranes, our respiratory system. And then there's the adaptive immune system that we develop for a long period of time. And then there's also a passive immune system, which is like a borrowed immune system. So the importance of having a good immune system prevents viruses from getting into our system and also prevents it from replicating and multiplying. Also, the thing with COVID is it does have a tendency to cause sometimes severe inflammatory reactions, specifically more to the lungs. So that severe inflammatory reaction is something that we aim to suppress using different modalities. So the effects, PBM stands for photobiomodulation therapy. PBM has different names. Some people refer to it as LLLT or level laser therapy or cold laser therapy, but the actual word is actually for photobiomodulation therapy. What does photobiomodulation mean? Photobiomodulation means using a spectrum of near-infrared light that penetrates into the cell. And when it penetrates into the cell, it actually changes the internal biology of the cell within our body. Every system of ours actually originates from a cell. So the cell multiplies to become a tissue becomes an organ, and the organ becomes a system. So when we have anti-inflammatory effects, PBM, one of the benefits is it has anti-inflammatory effects. It reduces inflammation. Every infection leads to some amount of inflammatory reaction. The body is fighting against the infection. So there's an antigen-antibody response. Today's talk will be a little bit technical, so bear with me. We'll try to simplify things later on, but just to get the gist of what's going down. So what we're trying to do is suppress the severe inflammatory reaction in the lungs and have restore. So PBM is also used to use lung allergies, vocal allergies, periodontitis like gum disease, and also oral lesions. Now there's something called tumor necrotic factor alpha, and this has an effect on neutrophils, which are blood cells. So in COVID, there's a condition called ARDS, otherwise known as acute respiratory distress syndrome. ARDS is a state of respiratory failure. Normally, the person has increased in their breathing, and they also have difficulty in breathing, and usually they require ventilation or oxygen support. So this is one of the effects or the complications of it. Now, photobiomodulation actually helps reduce the neutrophilic influx and tumor necrotic factor alpha in the bronchoalveolar lavage. Bronchoalveolar lavage is the sputum or the collection of saliva which is actually in the lungs. And it also helps indirectly to reduce the ARDS, the acute respiratory distress syndrome, which is a complication of COVID. So the severity of the disease is positively linked to the activation and apoptosis rate of the neutrophils. Photobiomodulation, the neutrophilic migration to the lung tissue. That means when the lung gets overly inflamed and there's a lot of reactions within the lung, especially in the small cell of the lung or the smaller part of the lungs, which are known as the alveoli, that's where there's too much of inflammation going on, which causes a lot of secretion, which actually makes the patient more distressed and harder to breathe. Photobiomodulation may be able to help to reduce the amount of white blood cells that migrate to the lung tissue that cause the severity of the disease. So in other words, it may be able to help to prevent the worsening of the symptoms. Now there's something called interleukin-6 and CD4 and CD8. Photobiomodulation may be able to help reduce the interleukin-6 and CD4 and CD8 proportion. Now, CD4 and CD8 are all forms of our immune function, our immune response function, and they're actually what we refer to as T cells. So the CD4 and CD8 proportion should be ideally a ratio of more than 1. In patients who have low immunity, patients who have uncontrolled diabetes, uncontrolled heart disease, uncontrolled blood pressure, they have underlying lung issues, and patients who have underlying liver problems or kidney problems, or they have HIV or hepatitis or other conditions, especially in HIV, the CD4 and CD8 ratio is not balanced. So what we refer to as immunocompromised patients. And so these patients, their ratio of CD4 to CD8 is actually less than 1. So photobiomodulation has been shown to actually increase the CD4 to CD8 ratio to more than 1, which actually helps to boost up our immune function. It also helps to reduce pulmonary fibrosis, which is when the lung starts to harden, and acute and chronic pulmonary inflammation. So in acute pulmonary inflammation, where the lung is going through inflammatory changes, there's increase in the polymorphonucleosides, the interstitial space, and release of pro-inflammatory cytokines. That means there's going to be a lot of inflammation cells being produced as a response towards the virus. So within 2 days, the lungs can start to dysfunction, and this can cause collagen deposition. So the number of polymorphonuclear neutrophils, monocytes, macrophages, and lymphocytes start to rise. Photobiomodulation has been known to have an anti-inflammatory effect and inhibit inflammatory cell chemotaxis. In short terms, to try to make it into a pictorial kind of explanation, we have macrophages, and the macrophages can represent the police in our body. They are one of the modalities of how our body fights off the bad guys or the infection, like virus that enters into our system. So say if the body produces an overreaction and uses too many guns, in the sense that it uses too many interleukins or too many T cells, that starts to produce a lot of inflammatory reaction. And so there is a damage to, for example, bystanders and the buildings surrounding, rather than just the virus in itself. So in other words, the lungs will be damaged and has a risk of being damaged, as well as the alveoli, which is the surrounding structures around the lungs, can also be damaged. So one of the benefits of photobiomodulation is it helps to reduce an overly produced anti-inflammatory reaction produced by the one of the things that COVID has shown to be noted is that people who have overactive immune systems can actually have a negative benefit and can lead to more inflammation in the lungs. So an overly active immune system, especially when it produces an autoimmune response known as a cytokine storm, can be detrimental towards the patient itself. So an increase in the cytokines like the interleukins and concomitant with poor prognosis in respiratory distress syndrome. So the more the production of the inflammatory cells, the poorer the outcome of the lung complication. So the interleukin 1b has a central role in initiation of inflammatory processes, and photobiomodulation reduces the interleukin 1b, interleukin 6, interleukin 8, all which are also related to poor prognosis in ARDS. Photobiomodulation also reduces interleukin 6 and interleukin 8 in the lungs and in the plasma in ARDS. COVID has a tendency to reduce the CD4 and CD8 T cells, and the T cells play a crucial role in the immune response against viral pathogens. T cells are very important. So they're part of our immune response against viruses. And the CD4 helper T cells guide the B cells, cytotoxic T cells, and CD8 cytotoxic T cells, and eliminates these viral pathogens. So photobiomodulation actually increases the CD4 and CD8 T cells and improves the balance between them. Sometimes there's a delay in response in ARDS, which is caused by macrophages, and photobiomodulation has been shown to reduce this. So in short, photobiomodulation can help to improve the immune function. And it can also help to reduce the cytokine storm. The cytokine storm is when the autoimmune response produced by the body, and it's an over inflammatory response produced by the body, especially noted in the lungs and in the blood vessels. It also helps to reduce the poor prognosis of ARDS, acute respiratory distress syndrome, and also helps to reduce the risk of secondary infection. When the immune system is weakened, then risk of other bacterial or other viral infections, where the person can succumb to other illnesses as well, and also helps to reduce the overall hospital period stay. So these are some of the benefits that photobiomodulation may be able to produce and benefit the person. So this is a case study of a COVID patient who used photobiomodulation. It's an American 57-year-old who had pneumonia. Pneumonia is one of the complications related to COVID. And it showed that the patient had positive response in the condition after 4 days of using photobiomodulation for half an hour a day. The oxygen increased from 93 to 99%. The oxygen support reduced from 4 liters to 1 liter. And the chest X-ray also showed that lung edema also improved. The photobiomodulation is actually certified and FDA-approved treatment for both pain and inflammation in 2011. So this is actually a certificate, which is a medical device certificate. It's a registered medical certified device. This certification took around roughly about 4 years and had to go through about 4 stages of stringent testing for almost every single part in order to validate the device, and it's validated by a doctor and a group of doctors, and it's also a registered and a certified medical device. So that means in terms of safety, the safety is there, doesn't have any risk. The beam that is used, even though people refer to it as a laser, the beam that is used is not a focused beam. It's a 3R GAAIA laser, which is actually a divergent beam. And a divergent beam means that it's very safe and doesn't have any risks for any side effects. Also, the thing that there are variabilities in photobiomodulation devices, but the important thing is that they use a specific wavelength. For example, the wavelength has to be in around the range of 650 nanometers, and then the pulse has to be a continuous pulse rate, and the power that has to be used has to be 5 milliwatts, and this has 5 lasers, so it has 25 milliwatts in total. And also the energy that is used has to be sufficient. So all these factors make it beneficial for therapeutic conditions and can aid in various health conditions. So just a quick and a brief explanation about how photobiomodulation works. As mentioned, it's a light therapy that enters into the cell and causes internal changes within the cell that helps to improve the internal biology of the cell. It works basically what is known as the electron transport chain in the mitochondria and affects something known as complex 4 in the cytochrome C oxidase, which absorbs photobiomodulation light from near-infrared spectrum. This releases ROS, reactive oxygen species, from the complex and increases the adenosine triphosphate through increasing membrane potential. So basically, cell exchange of oxygen, of nutrients, the cell starts to become more viable to exchange of these items between the membrane of the cell, and thus it can absorb nutrition better, it can transfer oxygen better and other gases better. So this is the mitochondria, which lies within a cell, and that's where the ATP is being produced. And photobiomodulation works specifically on this area of the cell. So the higher the ATP in the cell, the more energy efficient the cell has. In the electron transport chain, one ATP molecule can be produced up to 8 times more by the end of the cycle. And the oxidative stress gets pushed into the bloodstream, and the cell starts vibrating at a healthier frequency. The immune system also starts functioning more optimally. Inflammation starts to reduce. The cells start to become healthier, and the body thus also becomes healthier. So I'm going to explain a little bit, since we've talked about photobiomodulation therapy, and explain a little bit about some other modalities that can also help to prevent COVID, or may be able to help. Apart from photobiomodulation being able to help, garlic is quite effective in terms of boosting the immune system. On average, consuming about 3,000 milligrams of garlic or even raw garlic a day. It's basically Allevium sativum, which is the complex inside garlic, which helps to improve the immune function. And some hospitals, even in India, they've used a steam inhalation for about 5 minutes once or twice a day, and they've had really good results. In one hospital had about 4,000 COVID patients, and they used a steam inhalation method to for all their staff and their doctors, and apparently none of them were inflicted by COVID. And of course, I'm trying to find the time. Now it's quite difficult with following SOPs and things like that. But even walking within the compound of the house, or even inside an apartment, or where it's viable in an open space, regular walking, regular exercise also helps to keep the blood flow going and keep the immune system functioning. And eating healthy, lots of fruits, lots of vegetables, drinking plenty of water, at least 2 to 3 liters a day, and sleeping somewhere between 8 to 6 hours is imperative for the body to get rest and to be able to detoxify. So in whole, these are some of the benefits of modulation in relation to viruses and in relation to COVID, and how it can help to boost up the immune function. As you can see, these are essential things: sleep, exercise, a good diet, and some supplements, and also a lot of positive thinking and keeping our mind positive during times. A lot of people are afflicted by mental health, depression, anxiety, various health issues as well. So it's important to keep a positive outlook and think positively and optimistically. So this is an example of how steam inhalation is done, and it goes up to a high temperature, which helps to denature the virus. Thank you very much, everyone. So we are open to question and answers. Anybody has any questions or anything they'd like to talk about?
Okay, let me view. Yes, can talk right now.
Hello,
Yeah.
can I talk?
Yeah, sure.
Can you hear me?
Yeah.
Okay.
Hello,
Can I
yes.
talk? Can you hear me? My name is Ramachandram. Yeah. Can you hear me?
Yes.
I just wondering if whether I can ask a question on just on COVID or just a little bit outside. So long it is related to our COVID, our Ventros.
Yeah, sure. Go ahead. Go ahead.
Go ahead. Okay. I mean I'm listening to your few of your videos and all that, and you know you're talking about you got very good results for I think yourself or Mr. Lim, that you know that diabetes has come down to 4 point something, and you know, and then the doctor told no need to use any more medicine anymore.
Right.
So it was HbA1c and fasting blood sugar was the one that came down. Well, I'm just wondering whether anybody is there an experience that where you have done OGTT so far. Just want to see whether OGTT is done so that that will give an indication that the pancreas is working properly. Number one, is there any test done on the OGTT, please? Yeah.
So in terms, if you're talking about photobiomodulation in terms of pancreatic function, yes, there is studies and clinical trials done that has shown that it helps to improve the pancreatic function. By one way, as mentioned earlier by Justin, it helps to improve the blood circulation, and also something which is referred to as nitric oxide of the organs to function at a more optimal rate. And this also helps to produce the better functioning of the pancreatic cells.
So have we? You see, I noticed that so far, have we done any you know any test on OGTT for the patient so that we know whether that will give you that's a gold parameter that will indicate whether
Yes.
pancreas. So have you got any results or anybody has done so far, please, on this matter? Besides HbA1c and fasting.
If you're talking about OGT, I think it's less used nowadays. People, what are you talking about? Like the OGTT and the 2-hour postprandial sugar test. So
Yeah.
nowadays, I think what a lot of people they is a quick reference is using a standardized ISO lab to monitor the HbA1c, which will be a 3-month average of what the glycemic control is like. But
Uh,
nothing specific to OGTT per se, but in terms of reduction in the HbA1c, there have been a lot of testimonials of people who have actually found that HbA1c is actually improved.
Now, why I ask OGTT is just for those who are not sure, oral glucose tolerance test. Why I ask this is because insurance companies, can you hear me?
Yes, I can hear.
Insurance companies are very particular about this oral glucose tolerance test, you know, because so that will actually give them the access for a medical card, etc., as far as insurance
Right.
companies. So that's why if there's any kind of test done so far, that will be very encouraging. Yeah.
I think it's hand in hand. If HbA1c starts to improve, it will also be a reflection of the OGTT also improving as well.
But have we have any kind of clinical test done that you know indicates so?
Nothing specific to OGTT, no.
Nothing specific. I see. Yeah. Sorry, can't hear. Can't hear.
So Eric and also Kenny. Okay. We start with Eric first. Okay, Eric. Yeah, I mute you ready. Any question you can ask right now?
Doctor, what is it? This virus RNA. What does it mean by RNA?
RNA is the genetic part of the virus. So it's just coronavirus family generally falls into the RNA family. So it's just It's just the genetic makeup of how the virus is. So
So
they have coronaviridae, like the MERS-CoV, SARS-CoV. So these all they fall into a specific category. So it's just a categorization for the virus.
so in it, RNA stands for?
It's just RNA.
Oh, okay. What about all these? Because you explain through all those jargon words of medical terms such as um, periodontitis, vocal cord injuries. Yeah, I'm not sure about the rest, but to me, I personally struggle with all those terms.
Oh, okay.
Yeah.
Confusion is like RNA is a separate thing. RNA is basically like ribonucleic acid, but RNA is RNA in terms of what I'll explain just now is trying to put into perspective is we have an immune function, right? So our body, everybody has an immune function. Like even the skin is a barrier immune function. Our respiratory system is an immune function. To keep it simple, when we have a virus is something that is outside the body. So a virus is a foreign body, like something that is not welcome to come into our body. So we are, for example, we are the host body. So when the virus comes into the body, the virus starts to cause a reaction within the body. And in terms of COVID, the virus starts to cause the reaction specifically into the lungs. So when it starts to cause that reaction, our body starts to produce an immune response. When it starts to produce an immune response, the immune response is to catch the virus and to help denature the virus, to get rid of the virus and basically kill the virus. So that is the main purpose of our immune function. So every time as we are moving around, we're touching surfaces, we're touching our nose, we're touching our eyes, touching our mouth before we eat, before we wash our hands, we are exposed to all sorts of bacteria, all sorts of virus in the atmosphere. Even when somebody sneezes or somebody coughs, they're going to be viruses in the air. So we are at constant exposure to various different viruses and bacteria on all sorts of surfaces and even aerosolized. Aerosolized means it's actively in the air. And what we can do is, if we boost up our immunity, like our internal immune function, that means our body, the way that how we respond to, like wearing a mask will help you to prevent the virus from entering the body. But once the virus has already entered the body, by certain immune functions, our body can actually help to get rid of the virus quickly before the virus starts to multiply and increase. So that's what I'm trying to explain.
Oh, okay. So
It's about having a good immune system. If you have a good immune system, people who are younger, they are healthier, they don't have things like diabetes, blood pressure, heart disease, and the age factor as well. The immune system starts to go down. So that's why they classify above 65, under 65. That's years of age.
mm-hmm. So what about those terms like increased CAMP or decreased TNFA, mRNA in alveolar micropatch, all those things? What does it mean?
So basically, we have an immune function, right? We have immunity in our body, and the immunity in our body starts to work at different levels. So some of the levels are macrophages. Main thing is to understand is we have macrophages, and like I explained just now, the macrophages start to produce TNF alpha and interleukins, and what the underlying message is that if our body produces an immune response, the immune response, if it's too active, it should be suppressed. And if it's just nice, it will be sufficient enough to kill the virus, and then the immune system can move on to protect our body further. So the baseline is that our immune function should be strong enough to be able to fight the virus. But if it produces the virus produces too much of inflammation in the body, then that can be a detrimental effect. So then the inflammation in our body has to be suppressed.
Oh, okay.
Okay, is it okay, Eric? I'm Andrew. I'm kind of stepping in to help you to look at some of the questions so that I ask you, it's easier for you to answer. Okay, Eric, is everything okay now?
There are a few more. What reduces PBM reduces IL-6, CD4, CD8 proportion.
Don't worry too much about that. Like it's just to understand the whole concept of these are basically various parts of our immune system. So our immune system is quite complex, and we have we have B cells, we have T cells, we have macrophages, we have interleukin cells. These are what we refer to as cytokines. So basically, they are inflammatory cells that are being produced. To make it short, like you just think about the white blood cells, and the white blood cells are like the police of the body, and they're trying to help fight a virus. So we should have a good immune functioning system, and when it functions well, then it will basically be able to fight the virus.
Oh, okay. So what does this term PBM means?
PBM is photobiomodulation.
Oh, okay. I'm done. Good. Thank you.
Okay.
Okay, thank you, Eric. Dr. Ashvin. Okay, one person is asking. His name is Jason. Okay, he has got high blood pressure, 160 over 110, and high cholesterol for 2 years or more. He was asking, can this IM laser device really help him?
So how photobiomodulation therapy works in terms of high blood pressure is it will help the intima media. The intima media is a lining in the blood vessel, and it helps to cause increase in the nitric oxide, which helps to increase the blood vessel and vasodilate the blood vessel. So it makes the blood vessel bigger and allow more blood to flow. So thus it helps to reduce the overall pressure in the body. And also it helps to circulate the cholesterol out from the liver into the bloodstream and help to clear it out from the system. So that's how it can also help for cholesterol. But still, I would recommend it as a concurrent therapy, meaning to say that if you have a blood pressure of 160 by 1, it's significantly high, and you would need to start on medication, taking a blood pressure drug, seeing a doctor, and making sure it's under control. And then concurrently, you can start photobiomodulation therapy hand in hand. The advantage of IM laser is it has also incorporated the technology of a magnet and acupuncture. So acupuncture, I think they've had it for about 10 years now, and magnet about 4 years. So all that also helps in tandem to improve the blood pressure and the cholesterol, but it should be used alongside with some medical therapy to bring down the levels. And then you should monitor your blood tests on an interval of at least 6 months, and complement it with a good diet and good exercise to balance it, and probably if you have stress, to manage the stress as well.
Okay, thank you. The next question is Miss Kamala was asking how come this therapy is not given in our hospital?
Well, I've asked the ministry regarding that one.
Okay, the next question is from Ku Sui Fong. She says that her guts have weakened since turning 60 years old. In that, fruits and raw vegetables now given her the foamy, watery stools for days. Can IM laser actually helps, and how? That means his guts, is it? Guts. Guts, guts.
Okay. Well, eating raw vegetables and fruits is what we refer to as raw vegan. And raw vegan generally can produce quite amount of air indigestion. Even if you're eating like wild grown or organically grown, does cause quite a bit of gas production. But if you're eating commercially prepared fruits and vegetables, raw without, especially vegetables for that matter, without like properly cooking it or washing it, there is some amount of residue of pesticides, herbicides, fungicides, which can impact the gut. And having watery stools, you would need to see a doctor and investigate your digestive system, even maybe do a colonoscope and see how your gut is functioning first, and then see what is causing your gut to be weakened. Is it because of your age factor, or is it because you might have some leaky gut issues? And it does definitely help to strengthen it should help to strengthen the gut in terms of improving the gut function from the stomach to the intestines. And what you need to do is first investigate what is the cause for the foamy watery stools that you're experiencing right now.
Okay, the other question is from Tressa Lee. Can breastfeeding moms take milk? And I was told that it will give allergy to the newborn baby. Is it true? That means breastfeeding
Are you
mother.
talking about IM laser or biomodulation, or I'm sure if it's talking about
No, she was asking whether a breastfeeding mother can take milk or not, because she was told that if they take milk, it will give allergy to the newborn baby. So she was asking whether it is true or not.
whether a breastfeeding mom can consume milk, like regular
Yes.
milk.
And give allergy to the newborn baby. Is that true?
Any classification for breastfeeding mom not taking milk? I think milk is a staple diet which is safe to take, provided they don't have any milk allergy or lactose intolerance. There are lactose intolerant milks as well, or soy milks or other milk options which are lactose free. So it should be safe. I think a lot of moms breastfeed and consume milk.
Okay, the next question is from Adeline. She was asking whether it is safe for customer who has done for mechanical valves replacement. Is it safe for those people who are can they use IM laser?
Yes, no problem for people who have mechanical valve replacement or who have pacemakers. It's safe for them to use IM laser.
Okay, any more questions, ladies and gentlemen?
Okay, doctor, I have a question here. Okay, someone to see who is actually messenger me. So the first question, I have white matter in my brain. Okay, then she has a second problem. I have mitral regulation heart valve problem, and third question is actually I have suffered from chronic insomnia. She's actually 65 years old this year. So just want to know how I'm laser able to help. Okay.
So in terms of what clinical trials have shown for photobiomodulation is it does help to reduce the Lewy bodies and for patients who have dementia. And then in terms of mitral regurgitation, heart valve, it helps for viscosity, improving the nitric oxide endothelial function of the heart. So they actually have better flow of blood. And for insomnia, it works by helping to improve the oxygenation to the brain, as well as it works on the stem cells by using the nose piece. It can help to increase the stem cell function and also to improving sleep quality at night.
Okay, the next person is actually Mr. Kenny would like to say something, would like to ask a question. So I mute Mr. Kenny now.
Hello, can you hear me? Hello?
Yes.
Oh, yes.
Doctor, I have a question to ask you.
Yes.
We heard in the news that the COVID vaccine is coming in the month of March. This coming March, the vaccine, COVID vaccine.
Right.
So I just want to ask doctor's opinion. It seems that we ourselves, we have a lot of ways to prevent COVID ourselves. Okay, we have a lot of ways to enhance our immune system. For example, we have IM laser, and we have I think we have many ways lah to enhance or boost our immune system to prevent COVID. Now, I just want to ask doctor's opinion. Do you still think we need the vaccine, COVID vaccine? Because I've heard that the COVID vaccine sometimes it has serious side effects. Okay, I heard in the news in other countries, some people they have serious side effects. So I think, okay, especially for all people. For example, in Norway, many old people died after taking the COVID vaccine. So I myself am very afraid to take the vaccine, especially I have a lot of allergies with medicine, allergies with food. So I am very scared to take the vaccine, and I think that I can boost my immune system myself because I have the IM laser too. I use it. So I don't want to take the vaccine. So I just want to ask doctor's opinion. Like, do we still need the COVID vaccine if we are confident we can protect ourselves? Okay, thank you, doctor.
It's a good question. I can't comment much about the vaccine because I don't have personal experience with the vaccine. But what I can say is that the vaccine has gone through all the clinical testings that are necessary, and it's partly advantageous that we get the vaccine at a later period of time. We can observe how the progression is. Also, there is a lot of fake news circulating around, so we have to be cautious about that. There have been known to be people having hypersensitivity reactions when that is with all vaccines. Like there will be a small percentage of people who are hypersensitive. They are very sensitive to certain chemicals or certain compounds. Just like, when you take antibiotics or when you take a certain drug, some people can be allergic to it. But rest assured, the vaccine is with the intent to help improve the outcome, improve the situation, to create herd immunity. Herd immunity is something that is very important. When people use certain modalities, some people are consistent using it every day. Some people are not that consistent using it every day. So there might be fluctuations. Vaccine injections, for example, that you take it 3 weeks apart, and then it helps to provide sufficient immunity, some between a 90 to 95% benefit. So that is a significant benefit, especially if people are on flights, they're traveling on buses, on trains, and in high density areas, and countries which are as advanced as Singapore, who is also using the vaccine, and even some of their politicians have already taken it. So I think safe to say we should have some confidence in the vaccine. The government is actually doing their best to try to get as many vaccinations as possible, and use and through doctors to allocate it for free, and to get it out there to the public as quickly as possible. So I would say that vaccine and using modalities would be two different things, because the vaccine will still be a vaccine.
Okay, thank you, doctor, for your response.
Okay, then the next question is just give me a second. The next question is from someone. Okay, he's asking, may I know what cause psoriasis? Is it due to the body immune system is down? He or she has been using IM laser for more than 3 months, and there is no any improvement. Appreciate your comment or response.
So psoriasis, yes, psoriasis is a condition. where it's got like a scaly plaque deposits all over the body. Sometimes it can be localized to certain areas. Sometimes it can affect the joints and cause arthritis. Sometimes it can affect the nails and cause nail psoriasis. So there are different versions of it. I assume that you're referring to the skin psoriasis, which is the most commonest form of psoriasis. Psoriasis is linked to the immune system. People who generally have higher amounts of stress or a stressful event, either one-off or over a long period of time, are highly more prone to psoriasis. Still, the underlying cause of psoriasis is not completely understood. But sometimes, because psoriasis is such a long-standing condition, like people have it for many years, and the time of duration for the recovery might not be so immediate. It might take some period of time. I think the nose piece will help because that will work on the central nervous system to also down-regulate the immune response. And it would be a combination therapy of a healthy diet along with stress management, deep breathing exercises, along with exercise as well to help work on the psoriasis. It's a multidisciplinary approach. So a lot of people, when they go through stressful events, the psoriasis tends to flare up. So it may require a bit more time and more diligence.
Okay, the next question is, can IM laser helps for those having bone hyperplasia?
It should be able to help because hyperplasia is generally caused when there's a lot of growth of cells of the bone and it is in an uncontrolled state. So one of the functions of photo biomodulation is it helps to regulate the growth of cells. It causes what we refer to as cell proliferation in a regulated manner. So it should be able to help.
Okay, Eric, we do have a recording done, and Eric was asking, does it help on epilepsy?
They have testimonials related to epilepsy would still be needed to be managed by a professional, a specialist, and you need to go on medications as well. But in terms of clinical studies, there have been clinical studies to show that in terms of epilepsy, the frequency of firing of the neurons have been shown to be slowed down with the use of photobiomodulation therapy. Definitely using the nasal piece will be more beneficial and should be able to help, but would require to be on medication as well at the same time and not stop the medication.
Okay, any more questions related to IM laser or any situation? You can always put inside the chat.
Andrew, I have one friend here.
Okay.
He is actually in 2019 went for medical checkup and they said she have a water cyst in the left breast, but nothing to be worried. Last year I went for medical in and they said I have a water cyst in my right breast. The report say it's a simple cyst, nothing to be worried. Sometimes it will disappear. My question is, how does this product able to help? Okay.
So generally, if it's a simple cyst, either diagnosed by ultrasound or mammogram, you need to go for a follow-up with your breast specialist. And how it helps is similarly in the way of the cell proliferation. So excessive cell proliferation is what usually causes these cysts or these cells to grow and multiply. So it helps to down-regulate that. Still, if depending on the size of the cyst, sometimes surgical management may be the only modality which is effective.
Okay, the next question is from Eric again. What about Parkinson's disease? What are the chances of recovering using IM laser or?
I think there's been some pretty good testimonials of patients with Parkinson's disease. Yet Parkinson's disease is a complex condition. So it also depends on how early the patient starts to use photobiomodulation. So if they start using the device at the earlier stages, usually the recovery is usually better. And sometimes for those who are very advanced or very late stage, it's more about improving the quality of life or improving just the overall, like the appetite, the sleep, the maybe some movements and bowel movements, things like that. So it depends on what stage the progress is. But I think there are quite a lot of testimonials of people who have Parkinson's who have used it.
Okay, the next question is, can IM laser helps to relieve low back pain?
There are quite a lot of people who have used it for lower back pain, but lower back pain is a very broad spectrum. A lot of people have lower back pain, and you need to go to see a doctor to diagnose what the underlying cause is, whether it's a lumbar spondylosis, sciatica, it's muscular related, or it's posture related, what the underlying cause is, and then sometimes it may be needed to follow up with a MRI scan or physiotherapy, and concurrently IM laser also has noted to be shown to help reduce the inflammatory reactions which are linked to lower back pain, and also in terms of the pain helps to regulate the pain function.
Okay, the other question is that my son has bad sinus, and how can IM laser helps?
So sinus is usually it's under the umbrella of atopy. Usually vasomotor rhinitis or allergic rhinitis is the underlying trigger for it. It's like a dust allergy or a sensitivity to cold or other causes. So it helps to regulate the immune system. The overactive immune system is one of the causes for us to have sensitivity to the sinuses. And sometimes the initial phase, which I noticed that more mucus is being produced, and then they actually tend to wean off it after that. So there are quite a lot of people who have benefited in terms of their sinusitis.
Okay, someone is asking, how does IM laser works, the concept?
The concept is basically it works on mitochondria. It spectrum light at a specific wavelength, and then it goes into the cells. And when it enters into the cells, it specifically works on the mitochondria to help produce ATP through a mechanism known as the electron transport chain. And when it produces this ATP, it helps to cause changes within cells that improve the function of the cell, increase, apart from which it helps to increase nitric oxide and also helps to regulate the movement of nutrition within the cell. Yep.
Okay, Apple is asking, can IM laser helps on Alzheimer?
There are quite a lot of testimonies and a lot of study done for dementia-related causes like Parkinson's and Alzheimer's, and photobiomodulation has shown to help in the clinical trials.
Okay, Kenny was asking on this, can someone show me a website or anyone on the internet I can get complete guide on how to use IM laser? For this question, I will answer on behalf. Kenny, please go back to the person that introduced this product to you or sell this product to you so that you can get whatever information from the person. Okay, thank you. For the next question, by Jenny Ng. What about a 70 years old experiencing pain in her thigh bone, gone through few tests and gone to specialists, no specific illness detect, and even specialists are unable to tell what caused the pain? How can IM laser helps?
So in terms of pain, there are different types of pain. There's musculoskeletal pain, there's phantom pains, there's bone-related pains. So pain is a very broad spectrum, but in general, there's something called cyclooxygenase or COX, COX, where and prostaglandins. So photobiomodulation generally helps to regulate prostaglandins and COX, and that in terms helps to downregulate the pain in the pain pathway. Some of the methodologies to use it would be targeted therapy at the specific site, and also to use it on the wrist alongside using the nasal piece to help the pain centers which are located in the brain. You'd also need to try to diagnose what the cause is, but if you can't diagnose what the cause is and you've already seen the specialist, then yeah.
Okay, Ivana was asking, she has been using IM laser for 3 sessions per day since 26th of January. And she feel a bit dizzy, and sometimes she feel, especially today, she feel a bit dizzy and having stomach upset. Is that the normal reaction, and why?
So some people are sensitive because they have different bars that can be adjusted. Normally, what is recommended is to go to a lower bar setting, like 1 bar, and reduce, not to start straight away to 2 or 3 sessions a day, but maybe 1 session a day if you're more sensitive, and then keep hydrated, and then slowly wean up to 2 or 3 bars until you feel comfortable using it. So not everybody has reactions. A lot of people use it and they have no reaction. Some people have a little bit of sensitivity towards it.
Okay, the next question, can IM laser help people with gout?
I think there's quite a lot of studies on this in terms of reducing the uric acid levels in the body. So there has been evidence to show that photobiomodulation does help to reduce gout.
Okay, the next question is, can PBM help to increase the hemoglobin level?
Not to knowledge. I don't think there's enough evidence to show that photobiomodulation can help increase the hemoglobin levels, but it helps to improve the cell function to make the cell healthier. So it would depend on what the underlying cause of the low hemoglobin is, and I would recommend, to find out what the cause is. So say, for example, the person is iron deficient, then, it would be necessary to take iron supplements, for example, or if there's a other underlying cause like thalassemia or some blood dyscrasia, you need to diagnose what the cause is and then treat it accordingly.
Okay, any more questions regarding IM laser? You can ask now, because it is so rare chances that we have Dr. Ashwin with us. So if you do have any questions regarding IM laser, please feel free to ask now.
Okay, Doctor,
Palsy. So yeah, cerebral palsy. So they are studies to show that conditions like cerebral palsy have been noted to have improvements after using photobiomodulation therapy. But in this case, definitely you have to consider whether or not the child or the person is capable of using it along with the nose piece, because that's where they're going to get the maximal benefit from the working on the brain centers. So compliance is may be an issue here.
Okay, Mr. Kenny would like to ask another questions. Mr. Kenny, can you just raise your hand so that I can find you? So that I can unmute you. I couldn't find you at this moment. Okay, we continue. Kamala was asking, IM laser any centers in KL? In KL, our head office is in KL, is in Taman Sungai Besi. Now, if you need any more information, please go back to the person that invite you, okay, for more informations. And Kim was asking, IM laser helps children with autism and ADHD. Does IM laser helps?
There's been quite a lot of study nowadays there are quite a lot of cases of autism and ADHD. So it does help to improve the brain function. So to make the brain more efficient, sometimes it also has a detox capacity, because some of these conditions have actually been linked to toxicity of heavy metals in the body, and sometimes that can be one of the underlying causes. So blood circulation in the brain, yes. So there have been quite a lot of study on autism and ADHD in terms of photobiomodulation.
Okay, Mr. Kenny was asking for asthma patients how to use the IM laser.
Right on the left hand, 2-finger breath from the wrist, and use it with the nose piece connected either to the left nostril or right nostril, and then alternate after 15 minutes. So twice a day.
Okay, what he meant is that how many times per day, the number of bars, etc. The intensity.
With 2 bars, and then once comfortable with 2 bars and there's no reactions or any issues, then can increase to 3 bars. 3 bars is the standard setting. So 3 bars, half an hour twice a day is the standard setting. Anything additional to that is may pose to be more therapeutic or more beneficial, but the standard is half an hour twice a day, along with the nose piece. 3 bars.
Mr. Anthony, please feel free to ask your question now. I have unmuted you.
Thank you. Doctor, I'd just like to find out, I have a senior who has got a pacer in his heart, and he likes to use the... I said I have got a very senior 60-year-old got a pacer in his heart. So how do you start using the IM laser on this person?
A senior with
he has a heart condition.
Okay.
He has a heart condition with a pacer.
So start with 2 bars, 30 minutes once a day, then 2 bars, 30 minutes twice a day. Then you can increase up to 3 bars, 30 minutes twice a day.
After what? How many days when you after the first 2 bars? Then a week or 2 weeks.
You can step up every 2 to 3 days, and after 2 to 3 days, if you find operating well, then you can comfortably go up to 3 bars, 3 minutes twice a day. And anything additional to that is supposed to be more beneficial.
Okay, thank you very much.
Okay, the next question is, let me see. Someone is asking, can IM laser cure pimples?
Yeah, there's a face applicator. So the face applicator helps to rejuvenate the cells on the skin. Still, you would need to combine it with a good lifestyle, proper sleep, diet, exercise, avoiding certain food, like fried oily foods, chocolates, and things that can trigger the acne.
Okay, and of course, the next question is, can IM laser help on trigger fingers? How to use? Thank you, doctor.
The trigger finger is usually related to a ligament or a pulley in the finger. So sometimes it can be quite complex, and sometimes the only modality is either steroid injections or surgery. But for early stages, you can try to use it and see if it helps and gives a good result for that. There are studies where it has helped for ligament damage and improving ligament function.
Okay, the next question is from Kim. Can a lung cancer patient undergoing oral chemo use IM laser?
So we normally recommend to give a 2-week gap after the chemo before starting to use, or even 3 weeks, 2 to 3 weeks after the chemo, and only then to start using. We don't recommend to do it simultaneously.
Okay, the next question is for a serious stage of Alzheimer condition where the patient could only take fluid diet. Patients currently using 3 times a day had severe weight loss. What is your advice?
In that sense, it sounds like a very progressed stage of Alzheimer's disease, and basically, similar to what I mentioned earlier, it would be in the aim to give a better quality of life, and to help the patient to be able to eat well, to sleep well, to have minimal pain, and to be able to have good bowel movements. So anybody on a fluid diet will generally have weight loss because the amount of nutrition and the consumption is very minimal, and the calorie is also very low. So I'd recommend to continue using the laser device, especially with the nasal piece, at least 2 to 3 times a day.
Okay, the next question is how to change the battery. Olivia, I will answer this on behalf of Dr. Ashvin. If you want to change the battery, you have to send it to the head office in Taman Sungai Besi. No one else can change it except us. So you have to change it back to send it back to the our office HQ, and we will change it for you. Only we can change it. Okay, Olivia. And the next question is Jamie was asking hearing partially lost due to frequent use of earphones. Basic treatment of IM laser can help improve the condition. Is it advisable to insert the nose piece to your ears?
Yes, this is off-label. Like generally, it's recommended to use the nose piece in the nose, but you are correct. Actually, there are people who have actually got a better improvement of their ear function by inserting the nose piece into their ear, and there are testimonies of people who have had early damage to their tympanic membrane or other parts of their ear canal, where they've actually got a better function in their hearing. But the best thing to do is to do a audiology testing to see how severe it is. Go to see an ENT doctor, diagnose how severe the hearing loss is, and then try the treatment out for a span of say 3 to 6 months diligently, and see the improvement subsequently after 3 to 6 months, and see how the improvement is. And of course, to avoid using those earphones, which are actually the types that are inside the ear as opposed to the headphones.
Okay, the next question is what about a person suffering from stroke since the last 3 months? I think he or she is asking whether those people who are suffering stroke from since the last 3 months, can IM laser help them? Basically,
Yeah, in terms of the technology and how it works, it does help to improve the blood circulation, and that's one of the main reasons that causes stroke. But sometimes you have to see what the underlying cause of the stroke is and have to manage that as well. If it's uncontrolled diabetes, if it's uncontrolled blood pressure, all that has to be managed as well. And you have to use the nose piece. You have to use it at least 2 to 3 times a day, if not more.
Okay, Anthony, I have unmute you. Please ask your questions. Thank you.
Thank you. Good evening, doctor again, Anthony here again. I have a patient, or rather a friend. He suffered from a severe stroke and has some brain damage where he was in coma for quite a short while. And now he has recovered, but of course he's like a stroke patient now, cannot walk well, and he cannot control his limbs, his hands. All right. So, would this help? And how can we start? What sort of level do we start with our IM laser?
So this is a stroke patient.
I believe it is, but according to what we say in Chinese, is their capillaries in the brain was damaged, and a sort of what they call, how to say, the capillaries It was damaged, so he went into coma.
Well, it's worth trying it out to use it to see how much improvement you can achieve. Basically, it helps with the circulation of blood in the brain and oxygenation. Stroke is also related to oxygenation. But if there's an actual pathology, like there's an underlying pathology, like there is something like a tumor, for example, that needs to be addressed, then that has to be addressed separately. So firstly is to understand what the actual cause is, and if there is an organic cause, then the organic cause, like a structural cause, then that has to be managed. And if it's just stroke related, then there may be some improvement with that, but it has to be consistently used at least 2 to 3 times a day.
How do you start with what level?
So if you want to be cautious, you can always start at 1 bar for 20 minutes, and then 1 bar 20 minutes twice a day over a period of every 2 days, increasing it. And then depending on how the response is, you can go to 2 bars 20 minutes, and then 3 bars 20 minutes, and then 3 bars 30 minutes. So every 2 days you can increase it until you comfortably get to 3 bars 30 minutes twice a day, then 3 times a day.
Okay.
Okay.
Thanks, Doc. Thanks a lot.
Okay. The next person is Mok Siu Ting. I'm going to unmute you now. You can ask your questions.
Oh, thank you. Can you hear me?
Yes, we can.
Hello, yeah.
Doctor, thank you very much for helping. Can IM laser help with frequent urinary problem at night, especially at night, say 3 times?
So I'm assuming the question is for yourself. So urinary problems will be depending on whether they are male or female. Different causes, like men have prostate, and the prostate can cause problems. So if it's for a female, then usually sometimes the urination problem is caused by multiparity. That means having many children, or the laxity of the pelvic floor, meaning to say that the ligaments at the genital area has become weakened, and the bladder is also sitting at a lower position, and that Kegel's exercise may be beneficial, and you might want to look into something like considering surgery if it's very significant.
Oh, but can IM laser help?
It will depend on what cause is. So if, say for the example, the cause is a centrally related cause. So for example, the person has urge incontinence. So in urge incontinence, there should be some improvement. So it would depend on what the underlying cause is.
Oh, I see. How do you use the IM laser in this case? Is it near the nasal, the stomach?
You can apply it at below the navel. You can do a targeted therapy with the belt. You can apply it below the navel and do targeted therapy at 3 to 4 bars, 30 minutes, twice a day. And you can also use the wrist with the nasal piece as well.
Oh, I see. I see. For old people like 72 years old, is it normal to have this frequent urinary at night?
Yes, it's very normal to have this. Normally, what we recommend is to not drink so much water late in the evening, to consume your fluid consumption more during the daytime, and then try to avoid fluids after 7 o'clock, and not too much coffee or tea.
Yeah, but after using this IM laser, we need to drink water, right? That's
So
the
you
problem.
kind of you direct your fluid intake day. So you consume more fluids, like your quota is 2 liters or 2.5 liters. You complete your quota at the earlier part of the day, and then you avoid your bladder before you go to sleep.
Yeah, okay. Thank you very much, doctor.
Okay.
Okay.
aneurysm.
Aneurysm. Can IM laser helps and how to use it?
Okay, so aneurysm is in general terms a ballooning of the blood vessel, and it would depend on how severe the aneurysm is. Aneurysms after certain diameter, the only intervention is a wait and watch approach, or go for surgery. But it's not harmful, and it won't cause any risk to the aneurysm. So safe to say it's worthwhile trying and giving it an approach.
Okay, so the next question is for ADHD child age 9. How to use the IM laser?
You can use on the wrist if it's difficult to make the child cooperative to use the nose piece. You can just use it on the wrist first, and just try to start off with 1 bar and then 2 bars, and you can even go up to 3 bars.
Okay, the next question is, will IM laser benefits thalassemia?
Should be able to help benefit thalassemia, because that is also related to blood viscosity and iron binding. So it should be able to help in improving the blood circulation, the blood viscosity, and help to reduce the side effects of thalassemia.
Okay, to improve overall immune systems, how do we use the IM laser?
We can use it on the wrist, at the Newgon point, P6 point on the left wrist, 2 finger breadths from the edge of the wrist. You can use it there. That is the link which is closer to the heart, so that's why the benefit of using it on the left hand side. And always more therapeutic to use it with the nasal line. Nasal line is where you get the maximal benefit, especially in terms of things that are related to the immune function.
Okay, the next question is a person who is having a right brain damage as a result of road accident. The left side of the body is not functioning and he has not been able to speak. Can IM laser helps?
So this is complex because you have to work on multidisciplinary approach, meaning to say that you have to get in a rehabilitation person, a physiotherapist, a speech therapist. There has to be a lot of work done to mobilize the limbs, and also in concurrent to use a photobiomodulation therapy side by side along with the nasal piece, and hopefully it's you can achieve good results, but case to case basis. But the earlier you start, the chances of recovery are usually better. But whether to say full recovery, it's hard to say. It would depend individually. But yeah, it would require a modality of a few different people working together to improve the outcome.
Okay, this is another question. For thalassemia patient who is a carrier, is it advisable for them to use IM laser? How can IM laser help?
So carriers, any thalassemia patients who are carriers, some of them, they have very minor symptoms, like just like feeling out of breath, feeling tired, not so good sleep, or when they exercise, they get to feel tired faster. So it will help in terms of the blood circulation, and it will help to make the patient feel more energetic and increase the ATP production.
Okay, the next question is can AVM patient use IM laser?
What AVM stands for?
Mr. JB, this guy is just putting JB name. So Mr. JB, what is AVM stands for? Please make a remark in the chat. We will get back to the question again. So the next question is for the ADHD child, can use how many times per day IM laser?
Safely use 3 hours, 3 times a day.
3 times a day. Okay. Mr. JB, please make a remark in the chat what is AVM stands for. And is there any more questions? we remember we don't always get Mr. Ashwin sharing with us. So you all do have any question, please feel free and quickly ask him now. His time is very precious, and it's very difficult for us to invite him to share with us on IM Laser. So if you do have any questions, please feel free to ask. Otherwise, if there is no more questions, we'll finish off our talk here.
I think AVM refers to as arteriovenous malformation. So yes, they can use it. They have to use it preferably on the hand that doesn't have the fistula. So for example, a dialysis patient who has a fistula done on the left hand, preferably to use the laser on the opposite hand.
Apple is asking, how about bone spur more than 20 years? Does IM laser helps?
To reduce the pain associated with the bone spur, because bone spur normally it will impinge and sometimes it will start to cause some pain. So it may be able to help in terms of the pain, but to actually reduce the actual size of the spur might be limited.
Okay. The next question is from James Wong. What causes skin allergy and can IM laser helps?
Skin allergy is a big topic on its own. There are many things that can cause skin allergy. So you have to try to determine what the cause is, like food to chemicals to pollutants to things that you apply, soaps and things like that. Sometimes stress in itself, or a poor diet, or lack of sleep. So you'd have to diagnose what the cause of the skin allergy is. And IM laser in general, photobiomodulation helps to improve the immune function. So once the immune function is improved, there might be some improvements in the allergic response of the body, but you still need to find out what the underlying cause is and treat the underlying cause.
Okay, the next question is, does IM laser helps with rheumatoid arthritis?
Yeah, rheumatoid arthritis is autoimmune, and the ablation has been shown to help with rheumatoid arthritis.
Okay, the next question is, does IM laser help in anxiety patients?
There are people who have anxiety used photobiomodulation and got good results with it. Also, you need to find out what the underlying cause of the anxiety is, and usually go hand in hand with other forms of treatment like stress management, and sometimes even need to see a psychologist and things like that.
Okay, Ms. Kamala was asking what is the cost of IM laser. Ms. Kamala, for the cost of IM laser, kindly please refer back to the person that that invite you. Okay. Now we go to the next questions. Does IM laser helps for thyroid inflated?
Thyroid functions, yes, there's quite a lot of studies done that have been shown that photobiomodulation help to improve in thyroid function. Also depends on what the cause is. If the cause is a goiter or there's a nodule, then that has to be addressed.
I think Mr. JB was asking, a patient with stun or shunt inside body, can they use IM laser?
They can use it. They have to use it on the hand where the shunt is.
Shunt. Okay. Does IM laser help those with sleep disorder?
There's quite a lot of testimonies of people using photobiomodulation to help with their sleep. Yes.
Okay. Any more questions? I think we answered quite a lot of questions already. There's another one more coming in. When using IM laser, the heartbeat increased to 120 beat per second. per seconds. Is that normal?
Not very common, but sometimes people do have something that is referred to as a healing crisis. So normally we just recommend to lower the intensity and then start building up slowly over a period of time, and usually that will be fine.
Okay. Tim was asking, can a person on dialysis benefits from IM laser?
There are testimonies of people who are kidney failure and on dialysis who have benefited in terms of their overall immune function and feeling better. The only contraindication is if they have had organ transplant.
Okay. Any more questions? I'm going to let Dr. Ashwin to answer another 3 more questions. The last 3 questions are before we close the talk. Any more questions here? I don't see any more questions coming in. Then I will pass back the MC to Jesseling. Thank you so much, Dr. Ashwin.
Thank you so much, Andrew. I just want to you who attended today and questions and listen to the talk. And I just want you to also take care of yourselves, everybody. Stay safe and follow the SOPs and be patient with this condition. It's a trying time. Sometimes spending a lot of time with your family is a blessing, but for some people, too much of time with the family also it can work against them. And it's just a different change of environment for a lot of people, and we are all social beings. We like to move around, and we have to limit ourselves right now, but it's for a long-term benefit and for the betterment of the society, and we have to think of the bigger picture. So thank you everyone for attending today. Thank you for your time and your patience, and I'd like to thank Jaslyn, Nicole, Andrew, Adam, and Mr. Lim and Mr. Tan for helping make this happen. Thank you. Stay safe, everyone. Yep.
Thank you, once again, it's time to be here with you all today. So I believe that for those who first time attended today's meeting or today's sharing, so you all know more actually how great our IM laser. Of course, we don't have enough to explain more detail on how IM laser will work on that. But maybe you all can refer back to your friends, maybe the friends that share with you all. Okay, so they might share more with you all. So today we have doctor have answered a lot of questions that also benefited to every one of us. So hope that for those who own IM laser, use it regularly to boost up our immune system. Okay, this is actually what we did every day. Okay, so the only one, don't waste it. It's actually, in fact, this is actually a very great device that very able internal, even external also, like especially during pandemic, right? So maybe some of them they suffer from toothache, sore throat, or maybe some backache or this thing. Okay, our device can in fact help to reduce the pain. Okay, the healing part, all these things. Okay, so one thing I would like to thank doctor and everyone here. Okay, thanks for your time, and I hope that you all benefited from today's session. Okay, thank you and good night. Stay safe. Okay, so let's pray that we have another session with doctor because doctor also very busy. So we are going to be to see again here. Okay, so hope that next time, let's say the doctor will be here, please invite your friends. Okay, we make it 200-300 people. Okay, so today we have a very good crowd also. Okay, I think who is actually raising up the hand? Wait, this one, Rama Chandra. Okay, question for you. Okay.
My nephew who has got Down syndrome. My nephew who has got Down syndrome, age 29 years, uses IM laser, but whenever he uses, yes, he is very restless. How to address the problem?
Using it with the piece or without the piece?
Sorry?
Is he using it with the nose piece or without the nose piece?
With the nose piece, yeah.
Okay, do you know what the setting is?
Sorry?
So what you do is you can reduce the setting. You can
Oh,
reduce the setting.
oh, I
You can
see.
reduce the setting to 1 bar and just start off at 15 minutes, and then just once a day. Then start off alternate days, and then slowly increase it up to 2 bars, and then slowly to 3 bars. Take your time and monitor his symptoms, how he responds, and also try to go on a diet which is less milk, less wheat, and see how he responds.
Less what? Sorry?
Less wheat,
Wheat.
HEAT, less wheat, and less
WHEAT.
yes,
I
and
see.
less
Less wheat.
yes.
Wheat, huh? Wheat, WHEWET, I see. And then what is the meaning of TAC for those liver cancer? After TAC, can we use our IM laser?
TCA.
TAC, that is the recommended treatment for liver cancer. Liver, they got cancer, they put TAC.
Okay. Yes. You can give a rest of after 3 weeks, and after 3 weeks, and you can build up to ideally 3 bars twice a day.
But normally this treatment is done. After that 3 weeks, they come back again. So in the intervening period, can we do it?
In the in-between period, you can use it, but you might need to wait for the treatment to be completely finished, and then only you can start using it.
Oh, I see. That means normally I think they will do. I think maybe every 3 weeks they do one shot, and maybe you take a few shots to finish. Am I right?
Yes, that's right.
So only after that do it. Cannot do in between. Not so safe.
It would be recommended to give rest to the immune function first, and let the body get the maximal benefit.
I see. I'm just wondering whether if you, because some say when you do this kind of treatment, people can die or people can, so will this help in alleviating that kind of problem? This if you do together? No.
In terms of using photobiomodulation or IM laser per se, it doesn't have any side effects or any risks. The only risk is when a person has an organ transplant done. So apart from that, other modalities is all safe. So it wouldn't increase the risk of patient.
Sorry, that means let's say, can we do simultaneously? Means today you do say you go through this treatment TACE, and then tomorrow between now and the next shot, then they can start using this so that it will try to help a bit. Can that be done or wait until the whole thing is over?
Ideally, you need to give at least 3 weeks gap for chemotherapy, for radiotherapy, and all these modalities. TAC, you have to give a sufficient gap.
Oh, why? Sorry, just wondering why is that we can't do it together, and then so that at least it'll help together. What's the reasons, please?
So because these modalities, they work through regulating the cells, and they have a specific modality on how they work. So we don't want to contradict that modality of treatment. So we just do one modality of treatment at a time.
I see.
So thank you, doctor. Some of the questions that we raised here, we need to know more detail. Because some is actually very of course, times doctor of the explanation from the medical perspective, okay, in terms of ours from layman's perspective. So hope everyone benefited from today's time. Okay, so thank you, doctors once again, and also all the participants here. So thank you and stay safe. Okay, good night, everyone.
Okay, take care, everybody.
Okay. So you can on this one your video, okay, to say goodbye to our friends, okay, or maybe you want to say something, give something to thanks on doctor here. Okay. Okay, thank you. Good night, James. Okay. Eunice, Andrew. Andrew, why you didn't this one unmute your your mic? Okay. Okay, Andrew is actually our GM. Okay.
Bye bye.
Thank
I
you. And
didn't comb my hair today.
I cannot on your video, is it? Okay.
Right. Okay. Thank you.
Thank you.
Stay safe,
Okay.
everyone.
Yeah. So I also long time never met Andrew already. EL, thank you. Okay. So who else? Eunice. Okay. Good night. And
Good night,
all
everyone.
your video. Okay. And say good night to